Welcome to an introduction to fertility. This video will help you understand the causes of infertility and some of the potential options for treatment. Infertility is a problem that many people share, as it affects roughly 15% of the population. Apart from an exhausting physical toll, it can also have a long-lasting emotional impact. But what is the cause of infertility? To answer that, we must first take a journey into the workings of the male and female reproductive systems to see how the process works when everything is running smoothly. Let's begin. This is a magnified image of the female reproductive tract. After intercourse, the sperm travels through the cervical canal, into the uterus, and then into the fallopian tubes. If an egg is released by the ovary at the same time, it is picked up by the tube. Once the egg is in place, it's fertilized by the waiting sperm and the journey of the embryo begins. The next phase will take place here in the fallopian tube, where the embryo starts dividing and slowly moving towards the uterus. It is helped along in this process by the beating of little hair-like projections called cilia. After multiple division cycles, the embryo expands into a blastocyst and starts approaching the lining of the uterus called the endometrium. The blastocyst then hatches out of its shell and starts invading the wall of the uterus. This process, which involves back and forth signaling between the uterus and embryo, is called implantation. If something is wrong with the embryo, like chromosomal abnormalities, it will often lack the means for this invasion. In most cases, these embryos will not implant. Implantation in the uterus begins about 6 to 9 days after ovulation. While the possibility of implantation occurs in most women every month, there's only a brief time when the uterus is actually receptive to the embryo. This is known as the implantation window. During this period of time, a hatched blastocyst may attach and implant itself into the endometrium on the uterine surface. If implantation doesn't occur within the window, the endometrium is shed and a new one produced with the woman's next monthly cycle. Now that we've looked at how the process is supposed to work, let's examine some of the things that might go wrong along the way. 40% of the time, infertility is caused by a problem on the male side. Sometimes sperm have trouble traveling through the fallopian tubes, making them unable to reach the egg. In other instances, the sperm is abnormally shaped and can reach the egg, but cannot fertilize it. Another 40% of infertility cases are caused by a problem on the woman's side. For example, the fallopian tubes can be blocked, preventing the sperm from reaching the egg. Or the uterus might have abnormal growths, such as fibroids, which can prevent implantation or interfere with the ability of the embryo to invade the wall. One of the most common problems is something called decreased ovarian reserve. This happens when there's a significant decrease in the number of normal and healthy eggs in the ovaries, a problem which increases with age. While a woman has about 1 to 3 million eggs at birth, this number dwindles to about 300,000 by puberty. Thereafter, she loses 1,000 eggs per month. By the time she's 35, there's been a significant decline in the quantity and quality of her eggs. Abnormal eggs can lead to chromosomally abnormal embryos, which can be a major factor in infertility and pregnancy loss. It is therefore even more important for doctors to be proactive with women over age 34, since the window of time when they still have good quality eggs is rapidly diminishing. Finally, the remaining 20% of infertility cases are caused by a combination of factors from both sides. So, what are some of the potential treatments for infertility? One of the most common procedures, especially for patients over 35, is called in vitro fertilization, or IVF, where doctors seek out the best quality eggs, fertilize them outside the body, then implant the fertilized embryos back into the uterus. During this process, they can also perform genetic tests on the embryos before transfer to minimize the chance of a chromosomally abnormal pregnancy. Another possible treatment is called intrauterine insemination. This involves the placement of sperm directly into the uterus during ovulation. There are also other hormonal treatments that can be combined with timed intercourse to help increase the chances of pregnancy. Your doctor will help decide which option is best for you. While infertility may seem like a complicated issue, it's important to remember that there's a great deal of hope and help available. With advancements in technology and the care and attention of your doctor, the chances are better than ever that you can achieve your goal of becoming pregnant.